My name is Ibraheem. I came to Ireland in 1993. I already had done my undergraduate in medicine in Nigeria, in Ahmadu Bello University, Nigeria. So I came to do postgraduate in general surgery. I've been in Ireland for over 30 years now. A lot of experience in general surgery in almost all aspects of general surgery. In those days, the training in general surgery is you do almost everything, which includes plastic surgery, cosmetic surgery, urology, orthopedic surgery, vascular surgery, and all that. So we went through all that. I have now about over 10 years experience in general surgery, working in different teaching hospitals in Ireland. Currently, I do over 200 breast augmentations in a year. I will do a few breast uplifts, breast reductions, and liposections of the abdomen. So these are the things that I'll be doing here most of the time. Getting to know what implants is suitable, usually it depends on individuals. Depends on what the person wants to achieve. In most cases, some people want to have very big enlargement, whereas others just want to have a little bit of fullness, especially those that are a little bit empty on the top. So because of that, it really depends on individuals. Sometimes you can have somebody who is very small and petite, want something very big, whereas you can have somebody who is very big, want something small. So you just have to tailor it according to what the patient wants. You help them, you guide them into choosing exactly what size they will fit them. Generally, implants can last a long time. The manufacturers usually will give us about 10 years guarantee, but the implants can last a long time, especially the current, the new implants now that we use. Hardly break, they hardly leak, but you need to change them when they leak or when they break. And that is very, very rare nowadays, so they can last a very long time. They can last for as long as possible. Yes, sometimes you can feel implants after surgery, sometimes you can't. It all depends on your padding, natural fat padding on your skin. It also depends on whether the implant is put in over the muscle or under the muscle. When it's over the muscle and somebody has a very little padding, then there's a small chance that you may feel the implant, especially the edge of the implants. So it's quite possible. Whereas if it's under the muscle hides the implant better, so you tend not to feel the implant. But everything depends, as I said, on the natural padding that you have, and also the position of the implant where it's put in the pocket. Most people recover very well after the surgery, so most people by the third day they'll be either feeling well and up and about. And most people will not require anything more than simple paracetamol after 3 days. But generally, we tell people after 1 week, you should be able to say go back to work. You should be able to do your light activities. You should be able to drive, for example, after a week, a few days to a week. But the healing period basically is up to 6 weeks. So normally we'd advise people for 6 weeks, no heavy lifting, no running or jogging, no swimming or gym for 6 weeks until well healed. But generally after 1 week, people should be comfortable enough to do a lot of things. Usually we place the scar in the inframammary fold, which is just below the breast fold there. And usually we make it as small as possible to allow the implant to go in. So usually it's about 5 centimeters in length, and it's under the inframammary fold. That's why we put in the scar. In most cases, so people put scars in other places, but here we find that's the most convenient and that's the safest. Yes, generally, once the surgery is done, we see patients back about a week after surgery. Then we see them again about 4 to 6 weeks after surgery. Then, of course, if there's any need to see them again after that, we make appointments and see them. There should be no problems at all. Of course, if there's any complications or any issues patients have, we'll always see them because we're all here. They all know where we are. So we should be able to, so aftercare is very good here. And that's one of the advantages of getting your surgery where you live, so that you can have a good aftercare. It depends. Usually we do the measurements. first of all, ask what it is that you really need. Feel your breasts have sat, you want them to be uplifted or not. That's the first thing. So it depends on, first of all, what you need. Secondly, we'll do the measurements, and normally in most people, the nipple and the highest projection of the breast usually should be around the mid-arm. If it's going low or it's sagged down, then there and then you know that patient needs an uplift. And so it's based on so many things, so many variables as well. So we will measure you, will guide you, and advise you whether you need an uplift or not. And for reduction, it depends on what people need. It also depends on individuals. Some people have large breasts and they want large breasts. So in this case, there's be no need to get reduction. But when they do have symptoms, or when they do have desire to get reduction done, then we will advise them accordingly.